so the lab, this is what we'll be doing this afternoon. Okay, so alginate impressions. Alginate impressions is what we use, and some of you that have come to Shadow here have probably seen us, or the assistants, take alginate impressions. And it's mostly to make the models. Here's an alginate impression. Here's a dry one. So they already took the model out of this. So there's a tray. Here's the impression material inside. So you get the tray, you fit it, you put the alginate impression, which is the material which is kind of doughy, and then you put it inside the patient's mouth, sink it down so that we get an imprint of the teeth. Okay? So again, some materials used in dentistry are not utilized in the treatment room. Other materials are initially used within the treatment area, then taken to the lab, which is what we do here, to do other procedures and complete the procedure. Impressions taken in the dental operatory are often made into models or cast in the in-house dental laboratory or sent to a commercial lab for procedures. So you take the impression in the operatory and then you bring it to the lab here or there, and we pour it up and make the models. Many functions are performed by the dental assistant, such as pouring the model, trimming the model, fabrication of provisionals, or custom trays. This is big. To successfully perform these procedures, the dental assistant must understand the properties of each material used in the steps. And that's important because, again, if you add too much water, that material is going to do something. If you add too much powder, the material is going to do something else. Same thing when you're mixing the stone. If you add too much water, it's going to be too runny. If you add too much powder, it's going to be too dry, and they're not going to behave the same. If the water is too hot or the water is too cold, they're not going to behave the same. And some of the questions are on the test, and we'll cover those. Okay, this is important. Hydrocolloid impression material. Impressions are taken in order to capture an accurate three-dimensional duplication of a patient's teeth or surrounding tissues. Then we pour it, we get a negative like I showed you there, an imprint, and then you pour it into gypsum, which is a stone. Okay, to make a positive. So then we take it out of the model and we have a, or out of the impression, we have a positive. Okay, this is on the test. Alginate, which is irreversible hydrocolloid. Okay, alginate, another name is irreversible hydrocolloid, impression material. The alginate is utilized when a relatively small amount of detail is needed. That's the important thing. Okay. So I don't really need all the nitty-gritty, all the nooks and crannies, all the deep pits and fissures and really fine anatomy. I just need something. Okay, so just a basic impression. So the alginate is commonly used in fabrication of diagnostic casts, also study models, and making opposing casts for dental prosthesis, custom trays, bleaching trays, mouth guards, and other dental appliances. I don't need too much accuracy. I just need a model. Okay, so that's when we use alginate. The advantages of alginate, you need to know this, that it's easy to use, it's economical, meets the accuracy requirements for many applications. Okay, it's adequate for certain things, but not all things. Okay, it sets pretty quick, anywhere from 2 minutes to, you can go up to 5 minutes if you use, but you can get some rapid set, and it sets in 2 minutes. It can be used for tissue and teeth impressions. Elastic properties allow to withdrawal over undercuts, areas of the teeth that are wider on the top than on the bottom. So sometimes you have teeth that you have a bridge, and if you use another material, that it's going to go underneath the bridge, and you try to pull it out, and you're not going to be able to take it out because it's a very rigid material, and you try to pull it, you're going to pull that bridge out. So sometimes it's good for that. The disadvantage is that it can cause tissue distortion due to the thickness. Okay, so if you need really accuracy on the gums, you're not going to use that, because as soon as you push that material, it's kind of thick, you're going to push that gum up. So what's going to happen to your impression? If you make a denture there, that denture is going to be too tall, because you push that gum up with the material, so you're going to get a model with high gums. And when you make that denture, you're going to have to trim it back. So that's one of the disadvantages. It causes distortion. But if you're not worried about that, if you don't need that tissue, it doesn't matter. Dimensional change, if you don't pour it up immediately, you have about 40 minutes. So within an hour, it's got to be poured. So you take the impression, you wrap it in a little paper towel, wet paper towel, and then you clean up, do whatever. And within an hour, it has to be poured into the stone, because it starts, moisture starts going out of it, and it starts changing shape. It starts distorting. Okay, the setting time for alginate is called the gelatin time. The time it takes for the alginate powder when mixed with water to completely set. It's called the gelatin time. Okay, you add the water to the powder, you start mixing, and it starts to set. Little by little it starts to set, and that's what's called the gelatin time. And there's two phases, or two stages, I guess. Working time, as soon as you put the water in there, you've got so much time to work with that material. From when you start to mix it until it's finally set. That's the total working time. Okay? That total working time is divided into mixing time? Oh, you start to mix. There's the mixing time. And usually, like for fast set, you have about 15 to 30 seconds to mix, okay? And then you've got about another minute and a half of setting time. But the total working time for a fast set is about 2 minutes. So for the fast set is about 15-minute mixing time. And the setting time is when once you put it into the patient's mouth, and that's what's called the setting time, once it's in the mouth. So you have mixing time, setting time, and then the whole thing is called working time. How much working time you have. Okay, so here, type 1 fast set working at setting times range from 1 to 2 minutes. And that you can vary by the temperature of the water you use and the water powder ratio you use. We'll talk about those. Type 2 regular set, you have anywhere from 2 to 5 minutes. And I think Dr. Cervantes ordered type 2, which is a longer working time for you guys. Okay, so if it's too runny and taking too long to set, we'll talk about it. You can use a little bit warmer water, and it'll set quicker because the heat allows it to set faster. Here we go. Temperature of water. The best way to control the set time is to manipulate the water temperature. The suggested temperature is room temperature. With increase, if you make it hotter, it sets quicker, so the setting time is decreased. With decreased temperature, so you make it colder, the working time is increased. Okay? So if it's taking too long for it to set, add a little bit of warmer water next time. If it's setting up too quick, make sure your water is a little bit cooler. But I think with the regular set, it should be plenty of time. We'll find out. Okay, the other thing that affects the set time is the water-powder ratio, powder-water ratio. Okay, alginate impression material will come packaged and with a measuring device for both the powder and the water. So you'll have a little cup for water, and it's divided into 1 scoop, 2 scoops, or 3 scoops, and you fill that to whatever line. If you're mixing 2 scoops, you fill it up to 2 lines. If you're mixing 3 scoops, you fill it up to 3 lines. If you're only mixing 1, to 1. And there's a scoop that will show you how to fill. Okay, low water to powder. So low water, more powder. That's going to give you a thick material. Okay, so low water, these you need to know, because there's a few questions on the exam. So low water to powder means you're going to have a thicker material. Okay. The consistency is difficult to manipulate, decreased detail, decreased flexibility, and rapid set time. Okay, so if you're mixing and it's kind of lumpy and your water-powder ratio wasn't right. if it's the other way around, if you've got too much water, so high water to powder, then it's going to be a little bit too runny. You're going to put it on your tray and it's going to start like drooping to the side. And other than taking longer to set and tearing real easy and deforms, the other thing is that, especially if you're doing the upper, you have the chance of the patient gagging easier because it's going to want to run down the back of their throat. Okay, and some of you will experience that today. I think last session, one of the students, I think, threw up. So you gotta watch out for that. So you gotta be careful. Okay, let's see. Yeah, this is important. Trays used for alginate. The most common type of tray used, and we'll show you, or you've probably seen it, are either plastic trays or metal trays that are perforated. And the reason they're perforated is because you need that material to go through the little holes, and once it sets up, it grabs on. If it doesn't have perforations with alginate, when you go to take it out, the impression is going to tear on the teeth, and you're going to pull out the tray. So it needs the perforations. And some of these plastic trays, if you're using plastic trays, there's a spray. There's like a little adhesive spray you need to put on it so it sticks a little better. We'll show you those. The proper way to fit them, and usually it's better to be a little bit too big than just barely big enough or too small. You want it 2 to 3 millimeters beyond the last tooth, and you want it, when you put it in the patient's mouth, you want to be able to wiggle it a little bit. You need some playroom in there, okay? And you should be able to slide it in and stretch their lips so that it fits. If it's too tight, then the alginate material there is too thin, it's going to rip on you. You're not going to get a good impression. So make sure it's big enough to go behind the second or the last molar, and again, kind of move it left and right so that it wiggles a little bit. Have 2 millimeters on each side, because you need material there for bulk. If not, you're not going to get a good impression. Okay, got a few minutes. Again, what we'll need, and we'll show you these. Kim will set these up. You need the spatula, the mixing spatula, a rubber bowl, which is just a big rubber bowl, the powder and the water measuring, wax, if you're going to take a wax bite, we'll do that as well. The impression trays, okay, again, just like with any patient, you're going to review the medical history, make sure you have the patient in the upright position, sitting up. Don't have them tipping back when you're going to take an impression, because that doesn't work very well. Make sure that you don't have any debris, because if you take an impression and they've got stuff stuck in their teeth, that stuff stuck in their teeth is going to be on the impression. So make sure if we worked on the patient before we take impression that they've rinsed out and don't have anything else stuck. Make sure you tell the patient what you're going to do. Mrs. Smith, we're going to be taking some impressions the doctor needs. I'm going to mix this powder and liquid. I'm going to put it on a tray, and I'm going to put it on your lower jaw or upper jaw. And it takes about 2 minutes to set. It's going to feel a little funny. Just breathe through your nose and wiggle your toes, whatever, and we'll take it out as soon as it sets, okay? And just let them know what to expect. So try the impression trays. If the tray doesn't really fit, you can put wax around it. We'll show you if you need to, just to extend the tray. And this is on the test. Usually want to start with the lower impression first. Why? Because it's the easiest impression to take. You have less gagging, especially if a patient who hasn't had an impression before and doesn't know what to expect. Start with the lower one first. It's easier to take. The patient doesn't gag as easily. So we'll show you how to get the powder. So you overfill it, you wipe it off. Okay, so then you add the water in there. The mixing time for type 1 fast set is 30 to 45 seconds. And that may be too long for fast set. I'd probably stick more towards the 30, but I think on the test it says 30 to 45. That's on the test. So the mixing time for type 1 fast set is 30 to 45 seconds. But I'd stay more to 30, because if you wait too long, it's going to be too late. It's going to set up on you. I'd probably go 15 to 30. Okay, so here you put it in there. You grab the bowl in one hand, and we'll show you how to mix it. Kind of like mixing frosting or cake batter. You want to make sure you get rid of all the lumps. Let's see. It's going to be nice and creamy. You don't want any lumps and dry stuff. Then you put it on the tray. These pictures are in there. You put it on your tray, kind of smooth it up. Okay, so once you have it loaded on the tray, go the lab. I'll show you. It's easier to show in the lab what to do. But depending if you're doing the bottom one, you normally go from the front, and you use the tray itself to spread out the cheek and place it. You tell the patient to lift their tongue up, and then you seat the back, and then you come forward, and I'll show you that. Let's see what else is on the test. Press the loaded tray. Again, press the loaded tray onto the teeth, placing the posterior area down first, followed by the anterior. And that should make sense, because if you have a full tray and you start with the front and you squeeze it back, what's going to happen to the material? You're going to squeeze it back, right? And you don't want it to go back, because you're going to gag the patient. They're going to want to swallow and spit it out at you. So you seat the back first and roll it forward, so you get all that excess coming out underneath the lips, and then you put it over the lips. And we'll show you when we do it. So always seat the back first and roll forward, top and bottom. So bottom like this, back and roll forward, top like this and roll upward. Okay, for the bottom, again, tell the patient to raise their tongue. Then retract, as you roll it forward, retract the lip. This is the biggest problem on impressions right here. You do not retract the lip. And you finish your impression, and your tray is right here on the lip. You want that lip outside the whole impression, because you want to get that roll of the vestibule, like those models right there. You don't see any lip right there. Okay, if you leave the lip, you're going to leave the lip back here. The lip is going to be right here, and you're not going to get this nice roll. This is what you want. You want that impression material to come up into the vestibule. You roll the lip, and you're going to get this nice roll of the whole gum. Sometimes we don't need all this. Okay, this isn't perfect modeling. We don't need perfect every time. For braces, for ortho and stuff, you need those, but for just regular bottles, but you need something to go up into the vestibule, because if the lip comes down, then you get half the teeth, and that's not good. Patients don't like to take them. You know, you may retake it once, but you have to take it twice and 3 times. Oh, let me take it again 4 times. They don't like that. Okay, so again, here, once you put it in the mouth, then you want to hold it. You put it in the mouth and just hold it. You don't want to put pressure. Okay, once you seat it, then just kind of put light, just kind of support it. Don't keep pressing up. Okay, just support it. Okay, to pull the alginate impression, you're just going to pull down. Make sure you have your, especially if you're using metal trays, put your fingers between the opposing teeth. So if it slides off, if this are the teeth, you're going to hit your fingers. If you pull just from the handle and it slides off, you're going to slap the bottom teeth with a metal tray. Then we're going to be fixing those bottom teeth. Okay, so again, when you're taking it out, especially if it's really tight, put your fingers between the lower teeth or the upper teeth. So if it does slide off, you're going to hit your fingers to the upper teeth. If it doesn't want to break the seal, then use your finger and go into the vestibule to break the seal. Okay, all you need is a little bit of air to get underneath there. So, what does it say right here? This is done by using a gloved finger to break the suction pipe seal. So just go in there with your finger and kind of wiggle it, and it'll break. There's a tray coming out. And then once you take it out, make sure you give them a saliva ejector or your high volume evacuator and a wet water and a wet towel just to clean their face before you take the other one. Again, it takes, here it says 30 to 40 minutes. You want to pour it up within an hour usually is good. And when you put it in a towel, the towel should be damp. It shouldn't be like dripping water. So wet a towel, squeeze it, and then wrap the impression. And you're just trying to prevent it. If you just leave it out in the air and then you're doing all your stuff, that is losing moisture. So as it loses water, as the material loses water, it starts shrinking. Okay? So just leave it wrapped in a little paper towel. And again, we'll show you that. We'll take a bite registration. We'll probably use the wax, and we'll show you how to use that. We'll have a lap knife, water, we'll soften it. So after you take the upper and lower impressions, we'll use a wax bite. And what that wax bite does is it tells the patient how to, or not the patient, the lab, how to put those models together. Those two models go together real easy. They fit like lock and key. Some patients' teeth don't. And you send the models to the lab, and they're like, well, how do these go? So we send a bite registration, and then they know how to put them together. We'll show you how to use those. This is a little, we can try some of this as well. It's a little squirt gun that you put on the teeth, and then you bite together. This sets in about 30 seconds. But the wax bite is just as good, but we can demonstrate this. This is the wax bite. You cool it, and that's kind of what this is with silicone. But again, that's the imprint of the teeth, and you put those inside between the models, and they can mount them. Okay, this is on the test, and that's why we'll go over it. Still, and we won't cover it too much because in a couple of weeks we go over this impression material in depth. But it's on this exam, and it's silicone. So you have Alginate, which is irreversible hydrocolloid impression, which you don't get too much accuracy. All we can do is study models, bleaching trays, and orthodontic retainers and that. If we want something more, with more precision, with more detail, we use silicone or polyvinyl siloxane impressions, okay? Silicones produce impressions that are highly accurate, highly stable, very resistant to tearing. Okay, the material comes in many forms, consistencies. There's a regular body, heavy body, and Mike comes down from GC, and he brings all his stuff when we do our materials, and he'll demonstrate some of the different materials that are used. But we need very accuracy for crown and bridge. Okay, some of you guys have been here for the shadowing and have seen us using the CEREC machine. Well, now we don't need any of this because we use the CEREC. It's a digital image. I think Alexis, who else has been here while I've been using the CEREC? Just Alexis. But again, so we don't use these because we just take a digital image now. But you were here yesterday.
Mm-hmm. And Tuesday.
Yeah, but you saw me use it for that bridge, the implants, yesterday? Or
no.
were you gone?
I think it was on Tuesday. It was for Guy's crown.
Okay. Yesterday I had a big case, 2 implants and 3 natural teeth. And because that's an aesthetic case, I sent it to the lab, so I couldn't use my machine. But I took a silicone impression. This can give me accuracy and very, very stable. So these I don't have to pour up right away. I can send that without pouring, and you can use it a week from now and pour it up, and it's still the same. Whereas Alginate, you got to pour it within an hour. This you got a few days before you need to pour it, and sometimes you can pour it and re-pour it and still get an accurate model. So what you need again are trays, guns. We'll go over all that. But the important thing is that it gives you accuracy. Okay, so that's what's on the test. There's heavy body, light body. Again, we won't go over that because we'll do that in a couple of weeks. But what's the important part? Between silicone and Alginate. Alginate is what?
It's basic.
Basic, yeah, good. That's a good way to remember. Very basic, gives you not too much detail, just the.
And you don't have much time to work with it if you do the other one.
Right. Well, the other one you don't have much time to work with it either. That sets up quick too. To pour it, you mean?
Yeah.
Oh, to pour it, yeah. That you need the alginate, you need to pour it within an hour. This, you can wait a few days.
Yeah.
But for silicone, the important thing is that it's very accurate. Got 1 minute. Gypsum is a stone that we use. Dr. Cervantes will go over it. Again, it's the impression, what's poured into the impression. The important things, let's see. Okay, you got 100 grams of powder, and this says 30 milligrams, but with our stone it's about 25. Okay, so he'll tell you how much water to add in there when you start to mix it. So it's 100 grams of powder to about 25 mils of water. And again, if you add hot water, it's going to set up quicker than if you add cold water. And he'll go over all this. You start mixing it, you put it on the vibrator to get some of those air bubbles out. Trying to see if there's anything on the test on it. Pouring the base too, he's going to go over that. Invert it. Separating the model. The trimming we won't do today. We'll trim the models that you pour up today. We'll trim when you do your bleaching trays. Let's see. I thought there was. No, that's it. Thinking of something else. Anyway, the pouring of the models will make more sense when you're actually doing it. That just goes step by step on how much powder and mix it. But he'll go over it. Okay, so when you come back, we'll take a quick quiz, and then we'll split up. No, let's see, no, yeah, we'll split up, or you will split up into groups, and you'll take impressions on each. Anybody have a heart murmur or anything like that that needs to be pre-medicated? No. Okay.
It's a horrible gag reflex. I'm gonna choke out. I've never done these without like totally dying and choking.
Really?
Horrible.
Oh,
yeah.
so your partner.
Your partner?
Make sure you have a good mix. You don't want a watery mix. You're gonna have lunch.
Just because I love her teeth, they're so perfect. Look at them.
Oh.
Tiny little.
All right. So we'll take the quiz real quick, and then we'll take impressions. We'll pour up the models. Take bite registrations. That should be it. It's a fun lab, and you guys are gonna get all messy.
Yeah.
Like this. Wake up.
I'm so tired. I have not been able to sleep good lately at all.